Good evening. I'm Psychiatrist Jay Fawver, live from Fort Wayne, Indiana. Welcome to Matters of the Mind. Now, in its 27th year, Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. Now, on a fairly regular basis, we are broadcasting live every Monday night from the Bruce Haynes studio, which lie in the shadows of the Purdue Fort Wayne campus here in Fort Wayne. And if you'd like to contact me with an email question that I can answer on the air, you may do so through that email of mattersofthemind at WFWA.org. Now, let's start tonight's program with an email that I just recently received. It reads, Dear Dr. Fawver, my family doctor has suggested journaling for me to deal with depression and anxiety, but I seem to only write and vent about the same problem or worry over and over again. Is there a more simple and creative way to improve my mental health through journaling? I think it's important for you to journal not only about your challenges and your struggles, but journal about your gratitudes. It's one of the best techniques that many people will find will be helpful when they struggle with depression and anxiety, because if you journal about your gratitudes, what kind of things make you feel grateful? What kind of things are you thankful for experiencing? That can be really therapeutic, and many people will think about gratitude during the time of Thanksgiving, last part of November every year, but on the other hand, if you do so on a day-to-day or a week-to-week basis, that can be make a big difference for you. So journaling about your gratitudes as opposed to simply your struggles and your challenges can be helpful. Now, journaling about your struggles and challenges can be helpful because if you look back on those struggles and challenges several weeks or months later, that can be helpful because you can start to sort out, gee, I kind of worked through that. That kind of took care of itself. And it can reassure you that if you're dealing with something that's difficult now, that you've dealt with things in the past that took care of themselves and you were able to cope one way or another. So it gives you reassurance that you have overcome challenges in the past. So journaling about your challenges, that's okay. Just make sure to look back on them a few months later and see how they came out. But very importantly, journal about your gratitudes. Always consider what kind of things can make you feel grateful. Thanks for your email. Let's go to our first caller. Hello, Kim. Welcome to Matters of the Mind. Kim, you want to know, what does it mean to have a treatment-resistant mental disorder? I don't like that term, Kim. I know it's a commonly used term, and it's considered to be a validated term, treatment-resistant mental health disorder. Treatment-resistant mental health disorder simply means that the treatments that have been trialed have not been effective. And by definition, for depression, for instance, it means you've tried 2 different treatments and they have not succeeded. And the problem with that is that the 2 treatments you might have tried might have had the similar mechanism of action. So if you tried 2 medications that predominantly increase serotonin and they both didn't work, well, that by definition gives you a treatment-resistant diagnosis. Treatment-resistant diagnoses are important for certain treatment modalities because a treatment like Spravato, also known as esketamine, is FDA approved for treatment-resistant depression. So you have to have had failed on 2 prior antidepressants. Symbyax is a medication. It's a brand name medication of a combination of Prozac and Zyprexa, fluoxetine and olanzapine. And that is a medication that's FDA approved for treatment-resistant depression as well. But that just means you failed on a couple treatments. So from that perspective, it just means you've tried a couple treatments. Doesn't matter what mechanisms they have, but you tried a couple treatments and they didn't work out for you. Whether it's depression, schizophrenia, bipolar disorder, many people will need to try different treatments. Now, the kind of treatments people have tried and either succeeded upon or failed upon will be important for us to know as clinicians, because we need to kind of line up those mechanisms of action on what worked better than something else or what gave you more side effects. And we try to put all that in kind of a gestalt to look at all your different treatments and their mechanisms of action to determine what direction we want to go with future treatment. So if you failed on a couple medications that had similar mechanisms of action, we don't want to go that direction again. We want to go a totally different direction. So treatment-resistant mental health disturbances simply mean that you've tried a couple treatments and they failed. Thanks for your call. Let's go to our next caller. Hello, Chloe. Welcome to Matters of the Mind. Chloe, you want to know, how important is it to have family support during a mental health crisis? Family support is phenomenally important, Chloe, because family support can help you kind of stay grounded. And your family obviously has, in many cases, known you for quite some time, and probably know you as well as anybody outside the family. And I always encourage family members to be part of the treatment. Now, the individual patient need to have the confidentiality, and we have the one-to-one interaction, but it's nice to get family interaction and family perspective on how somebody's doing. Family members can be supportive, family members can be encouraging, and family members can help you stay grounded, because they'll often notice that you're doing better or worse even before you realize it, because they're looking from the outside, looking toward you. You're with yourself all the time. So family members can hopefully be a means of trusted support to give you a good idea on how you're doing. Thanks for your call. Let's go to our next email question. Our next email reads, Dear Dr. Fawver, how do you manage and deal with grief on a daily basis? I'm extremely depressed and anxious all the time after losing more loved ones. Please help. How do you deal with grief on a daily basis? Well, number one, it's important to reminisce. Still reminisce and give yourself some time to reminisce, but it's also very, very important to try to get back in your functional daily activities. Socializing, staying active with interactions with friends and family, exercising. Be careful about your diet. Many people, when they are stress eating during the times of grief, they'll eat a lot of carbohydrates, and carbohydrates can make you feel terrible, especially if you're binge eating on them. So watch your diet, try to exercise more, try to interact with friends and family, and stay productive, stay active doing things. It's very important that when you're grieving, not to kind of withdraw to the point where you're not maintaining a productive activity and you're not taking care of yourself. That's why you need to get out of the house and stay out of the house. People who are grieving during the times of the COVID pandemic restrictions had a horrific time with their mental health. That was a terrible, terrible time in psychiatry, those 2 or 3 years where people were expected to socially isolate. It was detrimental for many people's mental health, and it continues to this day as residual effects, but hopefully we won't see those days again. And we can keep people interacting with each other and socializing, and that's what was so troublesome during the COVID pandemic. If you stay socially engaging with people, if you stay productive in your day-to-day activities, that can really help you with grief overall. Thanks for your call. Let's go to our next caller. Hello, Juan. Welcome to Matters of the Mind. Juan, you want to know how steroids affect the male brain, and does it have the same effects on the female brain? Steroids will have a little bit different effect on the male brain and female brain. There is a difference between the male brain and female brain. The male brain is larger than the female brain, but don't start feeling too good about that just yet, because women tend to use both sides of their brains more efficiently than do men, because of this little corpus callosum, this band of tissue right in the middle of the brain that connects the left to the right side of the brain. So women will use their left and right side of the brain, even though their brains might be smaller in some regards. Women have this particular area called the hippocampus, as do men, but women's hippocampus, hippocampi, that's the memory center of the brain, will be much more sensitive to the effects of estrogen, probably more so than men. So when women are decreasing their estrogen levels, they can have more trouble with memory. Men don't notice that so much because men typically are not getting estrogen to the degree that women will. Women will have the moodiness because of progesterone going up and down. When progesterone is going down, progesterone's byproduct is called allopregnanolone. When allopregnanolone goes down, it's like you're in Xanax withdrawal. You're like anxious, irritable, you have trouble sleep, and that's what happens during premenstrual symptoms. That's what happens during menopause for a lot of women. When their progesterone is going down, they get more anxious because of that effect. Men, again, don't have that kind of phenomenon with progesterone because men have negligible progesterone overall. Men do have testosterone. Testosterone is very gradual. Men don't go through what's called menopause to the degree that women go through menopause. With menopause, yeah, there's a slow decrease in testosterone, but it's very subtle and it goes on over the course of years, if not decades, after a man is in his mid-40s. And testosterone can help with drive, motivation. However, a man can overcome some of that with resistance training. If a man continues weight training, resistance training, that can retain a lot of the benefits that testosterone was providing. And we now know that men and women do tend to decrease in this particular level of creatine in their system. You can always talk it over with your primary care clinician to see if you'd be a good candidate for creatine supplementation. 5 grams a day is what people will typically take. But as men and women get older, they have decreased creatine in their muscle, their heart, their brain, and that sometimes can be detrimental in terms of muscle development and heart strength and even brain nourishment. So creatine is a very safe supplement for most people, and it's something in which you can talk with your primary care clinician as a means of trying to help in ways that the testosterone might no longer be beneficial for you. Juan, thanks for your call. Let's go to our next caller. Hello, Diana. Welcome to Matters of the Mind. Well, you want to know about premenstrual symptoms. How does it cause mood swings and irritability? It's because during the latter part of that monthly cycle, progesterone is going down. As progesterone goes down, you have decreased allopregnanolone. Without decreased allopregnanolone, you have more anxiety, irritability, and difficulty with insomnia, and that's where the irritability will come from. You also have a decrease in estrogen those last few days before your monthly period. And with the decrease in estrogen again is very sensitive in this area on the hippocampus, and estrogen is something that helps with the memory and concentration. So many women will feel like they have memory disturbances during those last days before their period. So premenstrual symptoms will be symptoms that occur anywhere between 3 days before your periods all the way up to 2 weeks before the periods. Premenstrual dysphoric disorder is a different type of phenomenon, but premenstrual symptoms will not typically be functionally impairing to the degree that premenstrual dysphoric disorder will be. Premenstrual symptoms, also known as premenstrual tension, can be annoying for a lot of women. Over 80% of women will notice premenstrual symptoms prior to their menopausal symptoms, as long as their ovaries are still functioning. So it's something that can be treated sometimes with oral contraceptive medications, which will artificially give you the estrogen and progesterone treatment during the entire month, but also medications like sertraline, fluoxetine, those trade names are Zoloft and Prozac, respectively. But those medications can increase serotonin, and it's thought that when estrogen is decreasing, inadvertently and directly, serotonin is also decreasing. So when serotonin decreases, you can also feel irritable and grouchy and more moody and depressed during that time. Increasing serotonin just during those days with a medication like sertraline or fluoxetine can be helpful for a lot of women, and that's why those two medications are FDA approved for premenstrual dysphoric disorder, where women exclusively get depressed and functionally impaired on those days before their periods. Thanks for your call. Let's go to our next caller. Hello, Earl. Welcome to Matters of the Mind. Earl, you want to know when a person has a very strong opinion and then quickly changes the next day frequently, is that a sign of mental illness? I don't know, Earl. It could be that they're kind of having a hard time with understanding what their point of view will be on things. So if you look at the middle part of the brain here, you've got the ventral medial prefrontal cortex right in here. The ventral, meaning on the lower side, medial being on the inside. Ventral medial prefrontal cortex helps you establish your opinions and your biases, your values, and your identity for that matter. And if it's not really strongly engaged, I mean, it's healthy to have an open mind, but that ventral medial prefrontal cortex on the inside part of the brain is where you establish your opinions and your biases and your ideologies concerning how you look at the world around you. So if somebody is telling you something that opposes those views, it can cause you anxiety, and that's where the dorsal medial prefrontal cortex kicks in, because the dorsal medial prefrontal cortex helps you stay socially engaged with those people around you. And the dorsal medial prefrontal cortex is asking yourself, is it worth it to really fight these people and argue with them about my difference in opinion? Or should I kind of go along with them? Or should I just actually align with their views? So if somebody has difficulty with their own identity, you can imagine how if they're around people who have opposing viewpoints on a different day, maybe they'll shift to those different viewpoints. Definitely not a mental illness, Earl. What's a mental illness is basically where you have an anxiety, mood, cognitive thinking disturbance that affects your ability to get along with other people, get your job done, sleep, eat, take care of yourself, socially engage. That's what a mental illness is all about, where on a day-to-day basis, you're having trouble really dealing with society and taking care of yourself and making good decisions and being able to be a productive person. So if your changes in opinion will not be problematic in that regard, shouldn't be a difficulty for that kind of person who changes their opinions based on perhaps who they might be around. Thanks for your call, Earl. Let's go to the next caller. Hello, Sydney. Welcome to Matters of the Mind. Sydney, you'd asked, can you have psychotic symptoms while you sleep? Sleeping basically puts you into psychotic symptoms, Sydney. Psychotic symptoms will be where you lose touch with reality, and that's what happens when you sleep, because your reality focus is right here in the left dorsolateral prefrontal cortex. That's your reasoning part of the brain. That's the thinking part of the brain. It's the part of the brain that allows you to judge, what's going on around you and make good decisions. This front part of your brain shuts down when you're sleeping, especially in REM sleep. So when you're in rapid eye movement sleep, this logical thinking part of the brain shuts down. That's supposed to happen, Sydney, because that part of the brain it needs rest. So when you're thinking really hard all day, you need about 6 or 8 hours of your brain getting some rest for you to think clearly the next day. So just like your cell phone needs to be recharged every day, so does your brain. And the way your brain gets adequately recharged will be by sleeping. So when you're sleeping, you go into REM sleep, and rapid eye movement sleep, by nature of shutting down the thinking part of your brain, will cause you to have some irrational thoughts, a lot of abstract thinking. If you happen to awaken during a dream, sometimes you'll see things or even hear things that aren't there. And so that can be considered to be a psychotic symptom, but it's not considered to be psychotic in the sense that you would need an antipsychotic medication for treatment itself. There are different types of hallucinations people can have. There are hypnagogic hallucinations where people will have visual hallucinations where they see things that aren't there as they're going to sleep. That's a hypnagogic hallucination. Some people will awaken in the middle of the night, especially when they're overly tired, and have what's called hypnopompic hallucinations. It's where somebody awakens at 2 and 3 in the morning and all of a sudden they see things around them. That's your brain still dreaming. And that's not considered to be a psychotic type of phenomenon. So we would not treat somebody in that kind of situation with medication. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, I've taken Prozac, 80 milligrams a day for 30 years to treat depression, generalized anxiety disorder, and obsessive compulsive disorder. Because Prozac is no longer available, I've been taking fluoxetine generically instead at the same dosage, 80 milligrams. I am finding that the generic is not working and wonder what other serotonin reuptake inhibitor medications in which you could switch. Prozac or fluoxetine is brand name medication. It was made by Lilly down in Indianapolis, and it went off the market in production in December of 2024. So it's been off production in this past year. Lilly, as a business decision, just decided they weren't going to make brand name Prozac anymore. Brand name Prozac came out in December of 1987. So it's been out for a long time, but they just said there's so many generics out there, it wasn't worth it for them to take to manufacture the Prozac in the brand name formulation anymore. The brand name formulation, if it's 80 milligrams, it's within 1% of 80 milligrams from a bioavailability standpoint. So when you're taking 80 milligrams of brand name Prozac, you're taking 80 milligrams of brand name Prozac. It's fluoxetine, almost right on the money at 80 milligrams. If it's generic, it could be as little as, do the math in my head here, as little as 64 milligrams. So yeah, you could get quite a bit less fluoxetine, maybe 64 milligrams or so, instead of 80 milligrams if you change over to generic fluoxetine. So what can you do? Well, what you're needing to treat OCD, GAD, and depression, what you're needing is a strong serotonin reuptake inhibitor, and there are several out there. All of the SSRIs will have a similar mechanism of action as does fluoxetine or Prozac. It's just they work in a little bit different ways. But the main mechanism of action of all the serotonin reuptake inhibitors will be blocking the vacuuming of serotonin back into the firing neuron, so more serotonin will stay floating around. So how else could you do that? Well, there's a brand name medication called Trintellix, still brand name. It will be brand name until within this next year, I believe it goes generic, but it's still brand name. But you can get brand name Trintellix, also known as vortioxetine. But Trintellix at 20 milligrams a day is giving you pretty potent serotonin reuptake inhibition, 20 milligrams of of Trintellix is giving you about 75% reuptake inhibition. So it's giving you reuptake inhibition on serotonin pumps, comparable to what you might see with brand name Prozac, sertraline or Zoloft, paroxetine or Paxil, Lexapro or escitalopram. Those are all other SSRIs, and they might work for you, but they're all generic as well. But you could try a different type of a serotonin reuptake inhibitor, but the brand name Trintellix is still available, and you might want to go with that as a possibility. Talk it over with your clinician and see if it would be a good fit for you. It's something in which we have found many people who have been on brand name Prozac, they do well on brand name Trintellix. 20 milligrams is what people will often take. Thanks for your call. Let's go to our next caller. Hello, Felix. Welcome to Matters of the Mind. Felix, you want me to describe the symptoms of disruptive mood dysregulation disorder and how is it treated? Disruptive mood dysregulation disorder is a term used for children and adolescents who have a lot of moodiness. Now, they used to be diagnosed with bipolar disorder. Then it was found that, as they grew up, they didn't really have bipolar disorder. So it's a moodiness that's out of control, a little bit higher than what you would expect considering the child's age or the adolescent's age for that matter. So it's often treated with mood stabilizers. So it will be treated similar as will bipolar disorder, which is a mood disorder that typically starts when you're 16, 18, 20 years of age. And it will start not uncommonly with manic episodes where you're not needing to sleep, you're having racing thoughts, you're impulsive, you're doing things and saying things you ordinarily shouldn't do. And it's a mood disturbance where all of a sudden you will crash into a low. Not everybody will crash into a low, but it's a shift in the moods. That's the whole phenomenon of bipolar disorder. Bi means two, polar means one extreme or another. Disruptive mood dysregulation disorder is a diagnosis of childhood or adolescence when they notice these kind of phenomena occurring, but it will be treated with medication. And obviously, since the child and adolescent is going to be overseen by caregivers, those caregivers and family members need to be involved in treatment as well to try to help out. Thanks for your email. Let's go to our next caller. Hello, Pete. Welcome to Matters of the Mind. Pete, you had mentioned your cousin had a nervous breakdown when she went off to college. What advice do you give students who are stressed out and away from home? I'd say, the nice thing about our technology nowadays is you can stay in contact on a very regular basis with not only your family members, your friends from home, but actually your therapists, your clinicians can do telehealth if you're in the same state in which the clinician is licensed. So there's a lot of ways to stay connected. But when you go off to college, the first thing I often recommend to 17, 18-year-olds who are going off to college is don't smoke marijuana. It's going to be offered to you, but if you use marijuana, it can give you a calming effect and make you not care, which is not good when you're trying to keep up with your academic challenges. But also, you can have difficulty with having a psychotic episode or having a so-called nervous breakdown, as you described. A nervous breakdown is a generic term for having a lot of anxiety, sometimes losing touch with reality, and being able to not function. So it encompasses a lot of different kind of conditions that can occur. But I'd say maintain contact with family, friends, therapists, clinicians. Don't use marijuana. Stay away from alcohol, especially if you're stressed out going off to college. And try to maintain some kind of extracurricular activity. You're going to be stressed out in college because there's different academic challenges for you, but they can be really fun. Your days in college, you're not going to be in class hour after hour after hour. You're going to have a class for an hour, then you're going to have 2 or 3 hours as a break, then a class for another hour. So I strongly encourage kids going off to college to stay physically active, stay socially engaged, try to stay away from any substances of abuse, and get involved in some extracurricular activities to try to give your brain a little bit of redirection sometime. And by all means, maintain contact with your clinician or your therapist upon your being away from home. Thanks for your call. Let's go to the next caller. Hello, Giovanna. Welcome to Matters of the Mind. Giovanna, you want to know, how does poor nutrition affect brain growth? I mentioned marijuana just now. That's the main thing I'm concerned about with brain growth, especially for adolescents and young adults, because marijuana will suppress the brain growth. Do we know of any medications or poor nutrition that suppresses the brain growth? I wouldn't say to the degree of something like marijuana, but poor nutrition, yeah, if you have a high processed food diet, similar to what you see with a heart disease. It's not going to be highly effective for brain growth, especially for a child or a young adult, because the brain needs a lot of nutrition, especially the good fats, the omega-3 fats, fatty acids that can help with white matter growth. White matter growth is the insulation for the brain, very important to help the brain communicate from one side to another. So a diet of fruits, vegetables, a reasonable amount of fat can be helpful in terms of helping you think and concentrate. But when you have a lot of processed food, a lot of fried food, that can sometimes make people feel really foggy. And we're hearing about some people having a gluten intolerance, where gluten will make them have a lot of difficulty with concentration and make them feel foggy as well. Giovanna, thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air, you may write me via the internet at Matters of the Mind, all one word, at WFWA.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. Thanks for watching. God willing and PBS willing, I'll be back again next week. Good night.
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronHealth.com.